more than sounds and lyrics combined to make a song. It plays an important part in our lives. Music is everywhere we go. Most all people listen to music, from young children to adults. People may listen to music on their way to work, school, while doing homework, or any other form of activity throughout the day. Regardless of the type of genre, music can make a person feel many different types of emotions. But what if I told you that music is used as a form of therapy and can help reduce depression? Hello everyone, my name is Maria Paz, and in this presentation I will discuss and explain what music therapy is, what depression is, and how music therapy is used to help reduce depression in adolescents. Let's start off by learning about music therapy. According to Dr. Kathy J. Kemper, music therapy is recognized as an established allied health profession that uses music to facilitate therapeutic processes. In other words, it's a therapeutic session which is either in a one-on-one or group setting led by a music therapist to help patients work through their problems non-verbally. Now that we have a basic understanding of what music therapy is, we want to make sure we understand the role of a music therapist. Kemper further says, a music therapist is usually a musician who has gone through specific training in using music and the therapist self to accomplish therapeutic aims, the restoration, maintenance, and improvement of mental and physical health. Depending on the patient, music therapists can use many techniques. A music therapist won't use the same techniques with a child as an adult because it depends on their condition. Two common techniques music therapists may use is ask the patient or patients to join in playing their instrument as shown in the first image, or simply ask the patient to listen to the music and take it in as a form of getting calm as shown in the second image. These are just two techniques out of the many that music therapists may use in a session. There are many people that may have an idea of what depression is but may not be certain. According to the Diagnostic and Statistical Manual of Mental Disorders, depression includes loss of motivation and energy, difficulty sleeping or oversleeping, physical slowing or agitation, change in appetite or weight, feelings of worthlessness or inappropriate guilt, difficulty thinking or concentrating, and recurring thoughts of death or suicide. As stated by Sam Porter in the Journal of Child Psychology and Psychiatry, mental illness affects up to 20% of children and adolescents worldwide. From that 20%, 2.6% of young people worldwide suffer from depression, therefore showing depression is something that frequently occurs in adolescents. Having learned both about music therapy and depression, we can now move on to talk about how these two topics go hand in hand with each other. Research done by Sam Porter and C. Brent Hendrick shows how music therapy helped reduce depression in adolescents. In Sam Porter's research, he had 342 young people that were divided into two groups, music therapy and usual care. The results showed that self-esteem had improved and depression scores were lower in the intervention group than the control group. During the sessions, patients were encouraged to make music and sound at the same time, receiving support and encouragement from their therapist. In C. Brett Hendrick's study, 19 participants were assigned to two groups as well, the group therapy using music techniques or the control group. A test was taken by all the participants before and after the therapy sessions. The results of the test were significantly different for the after portion, showing how music therapy helped reduce depression. In all, music is something that adolescents already find interest in. Therefore, using it in therapy, it will likely show improvements. And just like Kelly Meisler, a music psychotherapist, says, the music is expressing what they can't put into words. To conclude, music therapy is just like any other form of therapy, except music is used to help the patients express their emotions without having to say it verbally. Not only can music therapy be used with adolescents, but with anyone with any condition. My hopes are, by viewing this presentation, you have gained or expanded knowledge in this topic of music therapy. It may be you aren't an adolescent or have depression and may be wondering how this information can be significant to you, but you know someone who can benefit from this information. Therefore, I encourage you to share this information about music therapy with others. Thank you for watching.